Hello everyone, we're group 2 and today we're going to be teaching you about the fourth cranial nerve, which is the trochlear nerve.
We will first be discussing the nucleus of the trochlear nerve. The nucleus of this nerve is located in the lower midbrain, specifically the caudal mesencephalon of the midbrain. This section is immediately below the rostral mesencephalon. Next, we will be outlining the course of the nerve. The trochlear nerve begins in the trochlear nucleus. It comes out from the posterior midbrain. It then moves anteriorly and inferiorly in the subarachnoid space. Then it intersects the dura mater that is right next to the posterior clinoid process of the sphenoid bone. Its next movement follows the walls of the cavernous sinus. It then enters the eye orbit via the superior orbital fissure as its final destination.
The trochlear nerve is a motor-only nerve. In this video, you can see how the nerve turns the eyeball. We will now discuss the muscle that the trochlear nerve innervates. The trochlear nerve innervates the ipsilateral superior oblique muscle of the eye. This muscle is responsible for turning the eyeball down and outward.
We will now discuss the function of the muscles we previously talked about. The superior oblique muscle controls the eyeball moving downward, as well as keeping the eyeball from rolling back into the socket. Its primary action is internal rotation. This action is exhibited in looking toward the nose. Its secondary action is depression, which is looking downward. Its third action is abduction, which is looking away from the nose. The third action is the most effective movement. The superior oblique muscles provide visual stability. This muscle makes it so the eye resists the eye's innate tendency to rotate when looking up or down. The muscle also creates inward torsion, which keeps the eye towards the midline of the face.
This video exhibits how the trochlear nerve innervates the superior oblique muscle to move the eye downward. Damage to this nerve has serious results. Fourth nerve palsy is a consequence of unilateral or bilateral damage to the nerve. Fourth nerve palsy can either be immediately since birth or it can be due to trauma. People with fourth nerve palsy lose control of the superior oblique eye muscle. This makes it so the eye continually drifts up, which can make it seem like it's floating. This upward rotation makes it so blurry or double vision occurs. Additionally, the damage to this nerve can create weakness, so it makes the eyeball move down. This movement causes vertical alignment to be off, which results in image doubling. This is called diplopia. The trochlear nerve also makes it so the eyes are in sync when the head is tilted. Those with damage to this nerve get torsional diplopia, which makes them see two images offset from one another. So these are the people in our group: Elena, Hannah, Daisy, Jocelyn, and Talia, and we hope that we were able to teach you something about the trochlear nerve.